Hey everyone, it's Tabria, your Milk Trunk host with the most, back with a freshly bottled episode for you. Joining us today is Dr. Sara Reardon, a doctor of physical therapy and a board-certified pelvic floor physical therapist and women's health clinical specialist who owns NOLA Pelvic Health and founded the Vagina Whisperer, a global pelvic health platform that's on a mission to help people with vaginas live fuller, happier, and more productive lives. In addition to saving the world one vagina at a time, Dr. Sara is a TED presenter. Her TEDx talk is titled Rethinking Postpartum Care, and she's the proud mom of two. Welcome to Milk Drunk, Dr. Sara. Thank you so much for being here today. You are highly entertaining on social. I did a quick dive last night and this morning going through all of your videos, and you're very fun and engaging with your information and advocacy, which I really appreciate because I think it really helps people really take the information in.
Thank you.
Yeah, if you don't mind, I'd love to get into pelvic floor and everything that it entails. Can you let me know, when did that really first start? When did pelvic floor therapy become a thing? Because I didn't hear of it until I gave birth last year. So, yeah.
And I think you are not different from so many other women and people with vaginas out there. And so I am a physical therapist. I have a doctorate in physical therapy. I went to physical therapy school thinking I was going to be a sports trainer for the New Orleans Saints, which is my hometown. But during that graduate school period, one of my professors introduced me to what we called women's health back then instead of pelvic health. And it was really learning about these muscles in your pelvis that are responsible for peeing and pooping and pelvic organ support and pregnancy and birth and just all of these things that we go through, that we experience day to day as women. And I was like, this is fascinating that this part of our body exists, yet we don't even talk about it.
Mm-hmm.
And so right after graduate school in 2007, so I've been doing this for, over 17 years, I jumped into being a pelvic health physical therapist. I got my board certification. And over the past 17 years, I've worked with thousands of women who have come to me with issues anywhere from urinary leakage, painful intercourse, constipation, pregnancy and childbirth challenges, menopausal pain or discomfort. And I think that this is a part of our body that is so under talked about for reasons, various reasons. It's embarrassing. We don't even know it exists. Like, who do we even go to if we want to talk to about it? But it really greatly affects our quality of life. And so I started my Instagram, the Vagina Whisperer, and, it's really exploded. And I think that that's a real testament to how many people want this information and they're just not getting it from other places.
Yeah. Can I ask how you came up with that name? It's so
Absolutely.
fun.
It's an amazing name, and I can't take all the credit for it. Again, after graduate school, I jumped right into being a pelvic floor physical therapist, and I was sitting around a pool with a bunch of my college friends, and a lot of their moms were there. And this was in Boston with, a big group of college friends. And I told them what I did, and they all called me the Vagina Whisperer because at the end of every day sitting by the pool, I ended up with all of their moms in the hot tub talking about bladder issues and menopause. And they were like, gosh, she's like the Vagina Whisperer. And so they really gave me that name. And when I started my Instagram, it was for all of us having babies, just like you did, and going through pregnancy and navigating, childbirth decisions. And they were like, what do I do? And so I started my Instagram just to kind of start sharing information to them. And they're the ones who called me the Vagina Whisperer.
I love that. When I got the invite for the episode or to speak with you today, it said the invite was for Dr. Sara. And I was like, who's Dr. Sara? I'm meeting with a Vagina Whisperer.
I much prefer that. It's so funny because I have two boys who are, school aged. And last night at dinner, we were talking about everybody's nickname. Everybody's superhero nickname. They're like, Mom's the Vagina Whisperer in her vulva costume. And I was like, we must be the only house where these names are just tossed around at the dinner table, normal conversation with, 3 other boys in the house. So it's pretty amazing.
Wait, speaking of your vulva costume, that's hilarious. I need to know, like, when did that first debut? You said it was like one of the best investments you ever made. Please tell me about that.
Hands down, it cost like $120. So when I, back in the early days of Instagram in like 2018, when you hit 10,000 followers on Instagram, you
Mhm.
got the swipe up feature where you could like link
Yeah.
something. And that was like, wow, I've made it on social media. And when I hit 10,000 followers on Instagram in 2018, I actually have a twin sister who's in marketing. And I was like, what do I
Oh
want
my
to do
gosh,
for
that's so
this?
cool.
Yeah, it's really cool. And she's so helpful. And I was like, what do I want to do for this? She's like, you should do something fun and like dress up and make it a big deal. And so we searched online, and it was between that stuffed vulva costume, which I still have, or like this other one with like this old lady, kind of like old crotchety, vagina. And she was like, go with the fun one. And so we did that. And we just did this like 10,000 follower video. And now I still have it this many years later. And it's
Yeah.
one of my most prized possessions. And they don't sell it anymore because I would get backup versions of it. But it's just a fun way to, I think, we can laugh about pelvic floor issues like, oh, I just peed my pants, or,
Hmm.
everybody, leaks when they get older or whatever. But I want us to have these conversations, and I want us to take these issues seriously, but I also want to bring some levity to these conversations because
Yeah.
that's how we're able to approach them. Just like we talk about back pain or, skincare routines. We want to just make this a normal part of our conversations. And I think that will help support more women to talk about these problems if they experience them, and then get the resources for them.
Yeah, I totally agree. I think making it like lighthearted and relatable, it makes it so much easier to talk about. So what are the most common issues that you see when it comes to the pelvic floor in your patients?
Well, I would say it's a variety. It's
Mm.
anywhere from, some of the more common things we see are like urinary leakage, or painful intercourse is a really big one. Sometimes abdominal separation, or what we call diastasis recti, which is really common after
Mhm.
giving birth. Vaginal pain with menopause, but one of the biggest areas I focus a lot is obviously on pregnancy and birth. And
Mhm.
one of the reasons for that is I went through it myself, and I had all of this knowledge from being a pelvic health therapist. I saw a pelvic health PT in my clinic during those times. And I was like, everybody needs these resources. Like, why am I just the lucky one who picked this career path, who got all of this
Mhm.
info? And I had a relatively comfortable pregnancy, and I had a really great postpartum recovery, pelvic health wise. And I was like, everybody deserves this. And that's really where I just started sharing that information, because I
Mhm.
think that, yes, we do worry so much about the health of the baby and the birth of the baby, but somewhere along that line, the mom gets left behind. And even when we
Mhm.
talk about postpartum care, we only get that one visit, and research shows that 40% of moms don't even attend that visit. And
Really?
yeah. And it's like, because
Wow.
what's the value? It's not even a physical exam sometimes. It's maybe a chat
Yeah.
about birth control or returning to sex and exercise. But other than that, our bodies have experienced this huge transformation, but there's no support afterwards. And not just with
Right.
pelvic health, with mental health, with, lactation and breastfeeding. We see it in all arenas. So I just think that, it's really, and again, just like you had a baby and you're like, I didn't even know the pelvic floor was a thing. So I think if we can
Mhm.
really proactively educate people during pregnancy that aches and pains aren't normal, that if you have leakage or constipation or painful sex, like, get them addressed during pregnancy. Don't wait until afterwards. We help a lot of women prepare for pregnancy, teaching them how to push, teaching them how to relax their pelvic floor muscles,
Mhm.
giving them stretches and exercise to train their bodies for this really huge physical experience they're about to go through, and then arm them with education and tips and guidelines for recovery afterwards. So, really supporting women and families and moms through that whole experience, versus just like saying, okay, just, they'll tell you what to do. And then you get sent home, and then you kind of feel a little bit left behind because nobody's caring for you.
Totally. That's exactly how I felt at my 6-week appointment. I saw, my OBs and my midwives concurrently, and, at both appointments, it was just like especially my OB appointment, because it was literally like 5 minutes. She did like a pelvic check and said, "Oh, you're good to go back to physical activity and for intercourse and all of that." And I was just thinking to myself, "Really? I don't feel
I
good
know.
to, just dive right in." And just because she told me that everything was fine, I just took it at face value. I was like, okay, well, I guess I'm fine. And then I went home and, tried to start getting back into the swing of things, but it just felt so off. It felt way too early to be engaging in anything like that. And my midwives, they were the ones who suggested I see a pelvic floor therapist.
Awesome.
But it was actually, I went to a chiropractor for my baby, and she was the one who referred me to one. So it was just like this whole roundabout way of finally getting the answers I needed. But yeah, I totally think that pelvic floor therapists should be incorporated into the like obstetrics unit of hospitals for sure, because it's so important.
Yeah.
I would have still been having pain and leaking all the time if I didn't see the pelvic floor therapist. And
Yeah.
I'm sure a lot of moms just think, oh, well, this is the new normal. I just have to deal with this, I guess, for the rest
Right.
of my life.
And to your point, I mean, it's so common. I think you sharing that really personal experience is like, okay, wow, a lot of people do experience this, but a lot of people experience back pain, but we're like, oh, take this medication, go see a chiropractor, go see a physical therapist. Like if you have a tear in your ACL in your knee, you get physical therapy before the surgery. You literally see a physical therapist in the hospital the day of, and then you get home health and then physical therapy afterwards. I'm like, people are getting more physical therapy and rehab for like a broken pinky and a ligament tear, which are both big issues.
Yeah.
Compared to like this huge transformation of pregnancy and then birth and postpartum recovery with hormonal fluctuations and, childcare challenges or taking care of babies. So, I think I've always been like, when you see your midwife or medical provider 6 weeks postpartum, like you should be seeing a pelvic health therapist at that exact same time.
Yeah.
Because there are guidelines to how to safely return to exercise and build your pelvic floor back up before then and returning to sex. But I even think during pregnancy is a really important time because so many, like we can think of birth as a really intuitive process, but we're not necessarily in a medical environment that facilitates that. There's a lot of things happening. And again, I'm kind of a data nerd. I'm like, research is very clear when women feel more empowered going into birth, they're happier with the outcomes, regardless of which way they gave birth, cesarean section or vaginal birth. So let's give them choices. Let's educate them. Let's help them feel like they're not passengers in the process, but really have that they're part of that process. And I think that will really reduce a lot of birth trauma.
When I was scrolling on your Instagram, I saw this one video where you said you were listing like things to not do when it comes to pelvic floor recovery. And one of them was don't do Kegels when you're peeing. And I was like, oh my gosh, I did that. And my pelvic floor therapist, she didn't tell me to do that, but it was just a video that I saw, like a good time to practice Kegels is when you're urinating, because that's how you know you're doing it right. And I was like, oh my gosh, I wasn't supposed to do that. I did that like a lot during my pregnancy.
Oh my gosh, I know. Oh and that's the thing with social media is that it's it can be so helpful to give people resources, but now there's just this oversaturation of information from, I mean, I would say like, there's fitness professionals and chiropractors and nutritionists and everybody talking about the pelvic floor, which is great. Like the more, the better, but you really need to hear your information from a qualified specialist. Like I have a doctorate degree and a board certification, have 17 years of experience. Like don't do Kegels when you pee, just hands down. Like maybe try it once to see if you can do a Kegel properly. But if you really understand how our bodies work, you would know that like, oh, that's not the best practice. And even physicians don't always get it right. So, nothing beats one-on-one care. I think if anything, social media has been amazing to raise awareness about this part of our body and raise awareness that pelvic health therapy is there to help support people with vaginas if they're experiencing any pelvic health issue or even want to prevent it. But you definitely need to get our advice from good resources. I saw somebody that was like, don't wear tight pants because it's going to cause your pelvic floor issues. And I was like, that's not true. I'm like, I live in leggings, girl. And my pelvic floor is fine. Like tell her mom she can't wear athleisure. That's going to be a problem,
Yeah.
So, but it's just, we're all trying, but I think that sometimes it's just too much information from too many angles.
I agree, definitely. I even saw that you were wearing it looked like underwear over shorts and it was used as a supportive
Yeah.
measure for your pelvic floor. I thought that was interesting too, because I didn't literally Kegels were the only thing that I was doing during pregnancy because I didn't know, I guess I'm strengthening my pelvic floor. Let me do
And you were
something.
not alone. And, it's
Yeah.
one of those things that, a lot of those support garments I recommend to keep you comfortable. I think that we, as women, as moms, we're like, oh, we just kind of have to endure discomfort. It just has to be
Yeah.
part of the process, where I'm like, it's not going to be always the most comfortable, but what can we do to help it make it as comfortable as possible? Do we need these support garments? Do we need to modify these movements?
Mhm.
What exercises can we incorporate it? I think discomfort and pain is information from our bodies that like something's not right. And to just be like, oh, it's just part of the process. I don't think that we would do that if it was, I'm not, I love men. I have a husband, I have kids, but I'm like, if it was a man who was going through this, I
Mhm.
think it would be a different scenario, And
Yeah,
so
totally.
I think that we've just learned to endure these things until recently. We're like, no, we deserve better. We want better. And there are resources to help make this a more comfortable process.
I agree. And speaking of that, I was talking to my aunt and we were doing 75 hard together and she's back in Nashville, so we would just do daily check-ins. And I was telling her like the workouts that I was doing because I had like a 3-inch diastasis recti, so I was working on, reducing that obviously and doing the certain exercises for it. And she was like, "Oh, what's that?" And I was like, "Oh, it's when your abs separate after birth and you have to really do concentrated exercises and movements to make sure that you get them back together again." And she was like, "Oh, I've never heard of that." And she has 2 kids. And so I was like, "Oh, you should do like the little diastasis recti test and see if you have it." And she did it and she did. She had like still separate. I mean, her kids are like in high school and
Yeah.
still had ab separation. So is it ever, I hope it's not, but is it ever too
Yeah.
late to seek out pelvic floor therapy, like, after you've had children?
Never. It is
Okay.
never too late. And I think that what you did just by sharing that, like these are the conversations we want to be having. Like sharing, hey, this is what I'm doing or this is what I'm experiencing. And there's support for that. And it's not just cosmetic. Diastasis recti is not just cosmetic. It is like can lead to back pain. It can lead to pelvic floor
Mhm.
issues. It can lead to just limited function. So we want to address these things. So
Mhm.
there was a day in my clinic where I had a young woman who had never had babies, and she was coming in for vaginal pain, a condition called vulvodynia. And she was walking out. And then I had another woman walking in who was in her 70s, going through some menopausal challenges with painful sex, but had had 3 kids and 3 C-sections. And I was like, this is pretty beautiful right here. Like
Mhm.
all ages, all stages, there is never a time that if you need something it's too late. Like we see women, hopefully it's weeks, but months, years, decades after birth, and
Mm.
it's never too late. And I think that even the older generation of women are going, oh gosh, in my day everybody just said this was like normal, but now there's
Right.
this kind of uproar of like, no, we want help too, And so I think that that's it's awesome, and we encourage it. I love it. Like I created this home workout program for pelvic floor exercises, and I was like, I want myself to be able to do it as a busy mom in my 40s, but I also want my mom to be able to do it as like a
Yeah.
postmenopausal woman in her 70s. Like we all ages and stages deserve this support.
Yeah. I tell all my pregnant friends, "Definitely do this after you give birth. Go see a pelvic floor therapist. Just do
I
it
love
anyway."
that. And even
Yeah.
during pregnancy, as you mentioned, like I
Yeah.
think strengthening is great. Like you didn't do anything that's, not recommended, but I think we often tell people to like, okay, when you get closer to childbirth, like pause the Kegels, like work more on relaxation and learn how to push properly. And, there's a lot that we can do to help people feel again empowered and educated going into birth because it is
Mhm.
scary
Yeah.
and we don't know what to expect. So I think that just again, educating and people as much as possible. Like we all take these classes on how to like take care of our babies, but where do we get the information on how to take care of our own bodies? And I really hope that
Yeah.
that's what we're providing for women.
Yeah, I love that. I wanted to ask, this is just random, but do you see male clients at your practice? Oh,
I
okay.
do. I do. I started my career seeing all genders, and there's been times that 50% of my caseload is male. I definitely see less now because I'm the Vagina Whisperer
Yeah.
and more women are wanting to see me. But
Yeah.
men have pelvic floor problems. They have pelvic floors and they also have pelvic floor problems. It's less obviously related to birth and menopause because their hormonal transitions are different, but everything from pelvic pain to constipation or pooping issues to abdominal pain, testicular pain, urinary issues, prostate issues. So absolutely. And there's a lot of pelvic health PTs who just see men or do both. So I definitely see both in my clinic here in New Orleans.
Yeah. Okay, cool. And is pelvic floor therapy, is that usually like a specialty situation that's not covered by insurance, or does insurance cover it?
Both. So
Okay.
it's this is such a great question because logistically, a lot of pelvic health therapists don't. We're what we're called not in network with insurances. So we have
Mhm.
insurance plans, and different hospitals or clinics are on with those insurances where you just pay like 35 or 50 or $80 for a visit. But your traditional physical therapy is, you see two or three people in a big gym and the therapist kind of bounces around. So that works fine for that model. In the pelvic health therapy model, it's one-on-one in a private treatment room. So
Mhm.
the way that we are only able to kind of sustain that practice, which is what's necessary, is by often being out of network with insurances. So
Mhm.
we charge a flat rate as if you were to see, an acupuncturist or a therapist or a massage therapist. And it's very transparent, but it's one-on-one care. It's really
Mhm.
individualized. You don't go to a pelvic PT 2 to 3 times a week. You maybe go once a week or once every other
Right.
week, and then we give you a lot of things to work on at home. But some insurances do cover it. Some therapists take insurance, some therapists don't. And then we can also give you these forms to send to the insurance to get some partial reimbursement. But it's a
Mhm.
real challenge, and it's not the therapist's fault. It's not the patient's,
Right.
fault. It's just the healthcare system is very challenging, and to really provide this individualized one-on-one care, it often means not working with insurance companies right
Yeah.
now.
Ugh, that's so unfortunate.
Totally unfortunate.
Yeah, I wish our healthcare system would get on board. There was like a trend going around on TikTok that where people were reading off their itemized hospital bills after giving labor. And I really thought that I had a home birth and everything went well. And so I just had like my flat rate that I paid to
Right.
my midwives. And I was like, oh, this is probably what I would have paid, if I went to the hospital. And it's crazy that even for like a totally normal hospital
Yeah.
birth, what the bills look like. I would
Yeah.
have paid more probably going, having a hospital birth. I
Totally.
literally couldn't believe it. It's just
It's absolutely outrageous. And that's one of the things is that at least with, I love that you had a home birth. I think that it's beautiful, and you really get that environment where you feel really supported. And so, but you also know like this is how much it costs. There's no like
mhm.
afterwards surprises. And that's the same thing with pelvic health therapy. It's like this is the cost of the session. There's no hidden fees where you're going to get a
Yeah.
bill months later. And so it's funny because I gave birth in a hospital, unmedicated for both of them. And I had
Mhm.
a doula, and I was like, I'm not going to pay for an anesthesiologist because I'm not getting, medication. So I'm just going to pay for the doula. And I also I
Mhm.
wanted that person there. But I had really rapid births, and I was probably in the hospital 3 minutes for the first one and 20 minutes for the second one. Like
Oh my
they
gosh.
were so fast, or I just probably waited at home too long. And then I got the bill and I was like, I wasn't even in that unit for like an hour. And I didn't even get
Wow.
Pitocin. And it was like tens of thousands of dollars. I mean, it was mind boggling. And
Yeah.
there's nothing you can do about it. It kind of just is. And so it's pretty wild. It's pretty
Yeah.
wild.
That's insane.
And doctors aren't like, I mean, they're so stretched thin, just like your 5 minute appointment with the OB. They're doing
Mhm.
the best they can, but the systems are congested, I guess is the way to say
Yeah.
it.
Yeah. Well, speaking of your births, clearly your labors were very fast. That's wonderful. But how was your postpartum recovery? Like, were they both similar to one another?
They were. I think that, my first one, my biggest challenges were with lactation and breastfeeding. So
Mm.
I had 2 unmedicated births. I did not tear with any of them.
Oh,
I would
wow.
love, I
Amazing.
know it was really amazing. And I think some of it was preparation, but some of it is just genetics, it's
Mm-hmm.
just kind of, I guess I just have stretchy skin, but I felt really, really fortunate with how my births went. They couldn't have gone better. But then after you have the baby, I still went through that experience of somebody hands you this child and I'm like, okay, what next? Like
Yeah.
I had very minimal pain. I had, what was more uncomfortable was the after pains of breastfeeding when you get uterine contractions and like my
Mm-hmm.
uterus contracting as I was breastfeeding. I was like, oh my gosh, that's what I took pain medication for. So physically my recoveries were great, but I really struggled with lactation. And that's another area that I just think is so confusing and overwhelming for
Mm-hmm.
women and families. I mean, we were up in the middle of the night, like searching for lactation consultants. We had a tongue tie. We had clip. I mean, it was just like your first 10 days of birth after birth. It was not what I had envisioned. It was
Yeah.
incredibly stressful. But physically they were good and I kind of knew what to do and I felt great. And that was one of the things that I said, I wish more people had this experience,
Yeah.
because I really do think it's possible. And there are reasons that we need cesarean births, and there's reasons that we need that people tear, and we need epidurals or vacuums or forceps. Like all of these medical interventions are there because they're necessary. But I do think that a lot of the beforehand preparation and within the labor experience, um, if changes are made to kind of just get out of the way of the process and let the process take place versus
Mm-hmm.
kind of piling a lot of things on. I really do think that there would be less pelvic floor and birth trauma
Yeah.
afterwards.
Yeah. Can I circle back to your feeding journey?
Yeah.
Did you end up formula feeding or you did a combo?
No. So what happened is I had an oversupply issue. So my first
Mm.
kiddo, the nurse in the hospital wasn't really super experienced. And so she put me on the pump on day 1 and I didn't know any better. And I was like,
Mhm.
oh, I guess I do both of these. So from day 1, I couldn't get my son to latch because he was being
Mhm.
bottle fed. And I didn't know that, like, once he's on the bottle, it's really hard to get him off the bottle. And
Mhm.
so I pumped like round the clock. And I had this woman telling me, a lactation consultant at my house, telling me, like, keep pumping. And so I was just sleep deprived. I was up every 2 to 3 hours. I barely got any lactation support in the hospital because they were busy and it's like I need help and they're just not coming. So it was just all very confusing. I When my son couldn't get on the bottle, they're like, it's because he has a tongue tie. So I got the tongue tie clipped. And then that was stressful because you have to do these exercises. So I mean, we were just drowning in the first
Mm.
several months. And so I pumped exclusively for 3 months. And
Mhm.
at 3 months, I was like, I'm going to try to get him back on the breast. And I spent the next 3 months trying to backwards breastfeed using nipple shields.
Yeah.
And then at 6 months, I was breastfeeding. So it's like it was just a totally crazy journey. My second one was much smoother. I kind of knew to not do the pumping right away and he
Yeah.
was just a better feeder. So it was terrible. And I almost wanted to have a second baby because I wanted a do-over because that first experience was so hard with feeding.
Yeah. I think that sometimes like I want a second just to try and do it quote unquote right or what I envisioned it to be for my next time. But
What were your
yeah.
challenges? Like was it feeding? Was it postpartum
Yeah,
recovery?
a latch because her latch was not good because she had a tongue tie as well.
Yeah.
And we didn't really have it assessed until she was about 4 weeks. So she had such a hard time with weight gain and it was stressing me out. And just, she
Totally.
was just losing weight, losing weight. So we actually just got her to like where she needs to be at this last 9-month visit.
Wow.
So yeah, it was a challenge, but they say every baby is different. Even if, you hear advice from people you trust or other moms, like it may not apply, but we just tried everything until something worked. So combo feeding worked for us,
Right. And I think
in
that
the
that's
end.
one of the things that looking back, I put so much pressure on myself to keep pumping and breastfeeding because, this was almost 10 years ago. The formula options were kind of the standard ones they've had for decades. And
Yeah.
now there are better formulas like Bobbie. And
Mm-hmm.
I'm such a fan, because if that was an option, I probably would have taken a lot of pressure off of myself to be like, you can only give breast milk, because it was hard. And I think I struggled in a lot of other ways because I didn't feel like there were other really good options. And now there
Mm-hmm.
are. And I think that that's a game changer for women and families. It just to give them options that are healthier, are just more aligned with what is in breast milk, and just then to give them a sense of security and safety that this is a really safe and healthy product for your baby. I
Yeah.
feel like 10 years ago that wasn't around. And I really, I would have probably done things a little bit differently if it was available.
Yeah, I feel that. Did you do pelvic floor therapy? I mean, I don't know if you could just assess yourself, but
Right.
did you do any of that after you gave birth?
So for my second son, we moved 3 months after he was born. We moved to New Orleans, which is where we are now. We were living in
Mm-hmm.
Dallas at the time. Both my sons were born in Dallas. And this is embarrassing. Like, it took me 18 months to go back and see a pelvic floor therapist, because
Really?
yeah, I mean, had 2 kids under 2, and I
Yeah.
wasn't working, and we had just moved, and it was like, and I knew, like, I wasn't having problems, but like I didn't go back to running for that long. And so I didn't even know like what my body was experiencing. So I didn't have pelvic health challenges, but I did go see a pelvic health therapist. And now I see the ones in my office kind of as needed. I tend to have more issues with tension. So like I'm a cyclist, I do workouts, and I tend to get more
Mm-hmm.
tension, which causes pain with sex. And so sometimes I'm like, oh, okay, now I need to like go get somebody to work on me or release my muscles. And I know what to do, but I still need one-on-one every once in a while for somebody to like tell me, hey, these are some specific things you need to work on, or just to get the work done. So,
Mm-hmm.
I feel really lucky that I have that resource that we literally can just schedule with each other in the clinic. But because my recoveries were good, I feel I had limited, pelvic health therapy usage after, but I did end up going to see one, just because at 18 months, I was like, I'm trying to get back into running and things just don't feel right.
Yeah.
So it kind of goes to your earlier question, like, it's never too late. It's
Mm-hmm.
never too late. And even if you wait 6 months, if you wait a year, if you wait several years, like, also give yourself some grace. Like, these are really hard times. And these are recommendations, they're guidelines, but everyone's journey is different. And if it takes you months to go see somebody, like, that's okay. I think it's really, we are there when you need us, when the time is right for you, and kind of honor where you feel like you are. Maybe you need to work on mental health. Maybe you just need to sleep. Maybe you need to, you're navigating feeding challenges, but it's there when you need it. So, but
Mm-hmm.
definitely be gentle with yourself if it takes you time as well.
Thank you all for joining us this week, and be sure to stay tuned for part 2 because this conversation is not over.